Hello everyone, welcome back to DRX Learning Hub. In today's video, we'll explore the historical background and development of the profession of pharmacy. Let's understand how pharmacy evolved from ancient times to the modern era of medicines. The profession of pharmacy is one of the oldest professions known to mankind. In ancient times, there was no clear distinction between a physician and a pharmacist. The same person used to diagnose, prepare, and administer medicines. The Greek physician Hippocrates is known as the father of medicine. Another great name, Dioscorides, compiled the famous book De Materia Medica, which described around 600 plants and their medicinal uses. In Rome, Galen developed many herbal and chemical preparations, and that's why traditional compounding is still called Galenical pharmacy. During the Middle Ages, the art of pharmacy was preserved and expanded by Arab scholars. Avicenna, Ibn Sina, wrote the Canon of Medicine, which influenced medical and pharmaceutical knowledge for centuries. By the 12th century, the roles of physician and pharmacist began to separate. Pharmacists were responsible for preparing and dispensing drugs. The Renaissance brought scientific thinking and experimentation. Pharmacy became a distinct profession, focusing on purity, accuracy, and dosage. By the 18th and 19th centuries, official pharmacopoeias and pharmacy schools were established in Europe and America. For example, the first pharmacopoeia appeared in Florence, 1498. The Philadelphia College of Pharmacy was established in 1821, the first in the USA. In India, pharmacy developed under both traditional and modern systems. During the British period, Western medicine entered India. However, pharmacists were not formally trained until the 20th century. Some key milestones. 1932, the Professor L.Schroff introduced B.Pharm course at Banaras Hindu University, known as the father of pharmacy education in India. 1948, the Pharmacy Act was passed to regulate the profession and education of pharmacy. 1949, the Pharmacy Council of India, PCI, was established. Since then, India has become one of the leading producers of pharmaceuticals worldwide. Today, pharmacy has expanded beyond dispensing into clinical pharmacy, research, quality control, and pharmacovigilance. Modern pharmacists play a vital role in healthcare and patient safety. So friends, that was the historical journey of pharmacy, from ancient healers to modern professionals. If you found this video helpful, don't forget to like, share, and subscribe to DRX Learning Hub for more pharmacy-related lectures. Thanks for watching, and see you in the next class.